Hi, I'm Theresa Bucy. I'm here today to demonstrate NG tube insertion and removal.
Hi, Theresa.
Hi. I have with me my colleague Donna Badowski, who will be reading the steps so that we're sure to cover everything that's expected of you in the return demonstration. I'm here with my patient. I've come into the room. I'm about to hand sanitize. My patient, Maritza Cortez, has a bowel obstruction, and the physician has ordered that we put in an NG tube to decompress her abdomen. So, Maritza, can you state for me your full name?
Maritza Cortez.
Thank you. Could you spell your last name?
C-O-R-T-E-Z.
Great. And what's your date of birth?
June 30th, 1960.
Great. Thank you. Maritza, do you have any questions about what I'm about to do? I understand the doctor talked to you about the procedure, but do you have any lingering questions?
Is it going to hurt?
It probably isn't going to hurt, however, it will be uncomfortable. The tube actually goes in through your nose and goes down into your stomach and relieves the pressure that you're experiencing. I think you're going to feel better overall because that pressure in your abdomen will be relieved.
All right, well, I'm kind of scared, so I just want to let you know.
Well, I appreciate that. And at any point, if you're uncomfortable, just tell me to stop or hold up your hand if you can't speak to me at that point, and we'll go slower. We won't rush you, okay?
All right, thanks.
You're welcome. All right, I'm going to raise the head of the bed a little bit, I think. Here we go. Okay, get you situated. I'm actually going to have you sit up a little bit. I'm going to drop this behind you so that you can tilt your head back a little bit when the time calls for it. All right, so don't mind me for a second. I'm explaining these things to my students.
Oh, I totally understand.
All right, students, I've gathered my supplies in no particular order. I know you have a list, but I've got my blue pad that I'm going to use to drape Maritza, the plastic side against her gown. That will protect her in case anything happens to gush out at us. Believe me, that can occur. Emesis basin, irrigation set. You'll use in the care setting lube, but what we're using for demonstration purposes is mannequin lube. We're going to need some tape. We've got a simulated litmus paper. This is for checking the pH of the contents that we aspirate. That's how we verify placement. We have a rubber band, a flashlight. I have my stethoscope so that I can auscultate bowel sounds. I'll keep that handy. Another flashlight. I have the ordered Salem sump suction tube. And I have an anti-reflux valve. I also have a pitcher of water and a cup. I do not have a straw, but I would have a straw so that she can sip as I start to advance the tube. Okay. With that, I believe we're ready to begin. Maritza?
Yes?
Do you have any allergies?
I'm allergic to Lasix.
Lasix?
Mm-hmm.
Okay. Well, we won't come into contact with any Lasix during this procedure, so you should be okay.
Okay, good to know.
Yes. Okay, then I should begin. I've done my hand hygiene, I've answered your questions, and we're ready to go. I've spread the pad to protect my patient, and what would I do next?
You would assess the condition of the nares and the oral cavity.
Okay, I'm going to do that with first I'm going to put on gloves, because you never know.
Oh, good idea.
Definitely. With somebody who has distension, the likelihood that they could vomit without warning is good. And also any bodily fluids, mucus, secretions, that type of thing that comes from their nose or mouth, you really want to protect yourself.
I hope I don't vomit for you.
If you do, it's okay. It happens all the time. I know people don't like to vomit.
I'll be so embarrassed.
Yes, but it's okay. It's just you and me. Okay. Now, I've got my gloves on. I'm going to use my flashlight to check the condition of your nares. Have you ever had any surgery in your face?
No, I thought about getting a nose job, but decided not
You have a
to.
beautiful nose. That's up to you to decide, but all surgeries carry with them risks. So if it works,
Yeah, that's why I kind of hesitated it, because I really don't like having surgery.
right. Okay, so the condition of your nares and your mouth, I've inspected that. We're good with that.
Okay. So then the next thing is, which you did, you positioned in a high fowlers with the pillow behind the head and shoulders.
Right.
So you can see sometimes you don't have to follow the steps,
That's
sequential
right.
order.
As long as we get the key thing accomplished, we can go in a different order if we,
Okay.
if it happens.
And you're right-handed, so you're at the right side of the bed. So
That's
for
right.
those students that are left-handed, no big deal. Just go to the left side of the bed. You don't have to ask permission of the
right.
lab
That's
faculty. All right, the next thing is you have the bath towel. Prepare your split tape.
My split tape. What we do once we have this tube in place is we have to tape it to their nose. Some facilities, and you'll learn this in lab, they have securing devices that are actually for this purpose. But for our purposes right now, I'm just going to use tape. I'm reluctant to put it on the bedside table because who knows what I'm picking up. So I'm just going to use it on her emesis basin. Even that is risky business. Okay.
All right, so then the next step is going to be marking the length of the tube to be inserted with tape.
Okay. So I've got my Salem sump tube. They'll explain to you the difference between Salem sump and other types of tubes in class. But what I'll do is open this up. This is not a sterile procedure, so I'm not going to drop it on the floor and then use it, but I do not need to maintain a sterile field with this. I can lay it here for the time being. And I'm just going to kind of give this a little curl to kind of make it pliable so that as it moves through her pharynx, it's not quite as rigid.
That was the next step.
Oh, perfect. Okay, so I'm going to consider that just about ready to go. What I also would do at this time is take my irrigation syringe. Make sure that you lubricate this because when you get it going, you're going to be doing it one-handed. So make sure it's well, it's moving well. Then what you want to do is attach it to the tube itself, not to the piggyback, not to the blue part. Attach the syringe to the tube itself. Okay? And if you want to at this point, I won't open this because it's brand new, but you could attach your anti-reflux valve if you're going to be using one to your piggyback or pigtail. Okay, so all right, we're using the method, and you will have been shown this. I'm going to demonstrate on this side so you can see.
Oh,
from
sounds
the camera.
good.
Maritza, I'm going to have you turn toward me a little bit, just
Okay.
for the sake of the filming.
I'm a little stiff right now, so I'm sorry. But
Yeah,
I'm glad you can help me do that.
I know
You still have to mark it.
that's what I'm doing.
Measure.
EX, which stands for nose, ear, and xiphoid process. And we're going to start with the tip of the tube at the nose, bring it around the ear, and then feeling for the xiphoid process, right about there, we're marking our tube. So we'll know when we're in as deep as we want to go. And then what I want to do with that is mark it with a piece of tape. Remember, whatever flag of tape you use here is going to be hanging out of the patient's nose. So you want to be kind of discreet about it. Use a small piece, just enough for you to know what you're doing. Going right about to here. It's tricky with gloves on, as you see.
Mm-hmm.
Right, and you could probably prepare your tape before you put your gloves on.